Information on the ideal sleep positions. Get a good night's sleep and wake up looking and feeling better. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas. And I'm coming to you with another video this week, and we're talking about getting some better sleep. Don't we all need that? Especially me. I need my beauty sleep. It's impossible to count how many questions I've gotten from patients over the years regarding proper sleep positions. A common comment you hear here in the clinic is, I think it's just how I sleep that causes my pain. Or something like, I think I just slept wrong, right? So what then would be the best recommendations when we talk about everything having to do with the topic of sleep? Well, we can't cover the topic of just the sleeping positions without also discussing things like mattresses and pillows. Well, let's start with mattresses. What is the best recommendation for a good mattress? Well, there's no absolutes in life, right? What works great for one person isn't really ideal for another. Having variability in your mattress is a great option. In general, being too soft, it's not that good. They don't make water beds anymore for a reason. And on the other end, nobody really wants to sleep on a brick, do they? I try to summarize this for patients by saying, get something in the middle, nice and comfortable, but not too soft. Let's dive in a bit deeper with firmness, okay? Firmness is very subjective, which means that the preference is likely different from one person to the other. If a person has a partner or a spouse, the preferences for firmness most likely going to be different. Not everybody's the same. And this throws a monkey wrench into the mix when it comes to picking out a mattress, right? And I'm guessing this has probably led to more than one argument over the years. Firmness can also be different from one person to the other depending on what kind of position they like to sleep in. Those that sleep on their stomach usually prefer a stiffer mattress, while those sleeping mostly on their sides tend to like more of a medium firmness in their mattress. And for this reason, I usually recommend a mattress that can be altered to fit the sleeper specifically. That's why I'm usually a proponent of a sleep number bed, because it can be altered from one side to the other to match the preferences of the individual sleeper. Also, some of those beds can also be inclined and raised from one side to the other. Some people do better sleeping in a recliner, right? Well, for that reason, if you have a sleep number, you can not only alter the firmness, but you can also raise it a bit. That can give you that kind of recliner type of feel and get you some good sleep. Okay, on to pillows. I have had patients over the years that have spent hundreds of dollars on pillows just to continue being unsatisfied, unfulfilled, and still on the hunt for the pillow that will get them out of pain. Hunting for the perfect pillow. Well, let's stop the madness on this, folks. All you need is a pillow that will keep your neck straight. And when you're on your side, your neck and head should be kept straight. Not too high and not too low. Straight. The same goes for if you're laying on your back. A straight neck. Not too up, not too down, not this way, not this way, just straight. So do not sleep with more than one pillow, okay? Don't do it. Now, positioning. Sleeping on your stomach. Okay, we'll start there. For most people, sleeping on the stomach is not usually recommended. If sleeping on the stomach is something that really can't be ruled out for you, well then it may be helpful to put a small pillow under the pelvis and or lower abdomen to keep there from being too much extension into the low back and over the course of a night's sleep. In addition to placing too much extension and strain on the low back, sleeping on the stomach tends to cause a squished face and leads to deeper and more numerous wrinkles in the face. Now, I don't know of anyone that wants more wrinkles in the face, right? And I'll also say that people who sleep on their stomach tend to always have their head to the side throughout the night. Lots of times that can give you some neck pain. Also, sleeping on your stomach, like I said, causes more extension in your back. If you have a really soft or light firmness in your mattress, it's going to cause that to be accentuated, and it'll be even more of an extension into your back, causing you even more discomfort. Now, if you've got a really good firm mattress, sleeping on your stomach might not be too bad. So it really, again, there are no absolutes, and it depends on person to person. Now let's talk about sleeping on your back. In the opinion of many experts, it's the ideal position to sleep in. It's an excellent position for keeping the low back nice and straight throughout the night. And not only do you avoid a squished face and more wrinkles, but sleeping on the back also helps with muscle pains and heartburn. However, for those that are overweight, sleeping on the back can be a source of more snoring. That's not always ideal for your spouse's quality of sleep, as you might imagine. In general, sleeping on the back with a pillow under your knees is, again, by many experts, considered the best way to begin a restful night's sleep. And I say begin because we're all likely to change positions throughout the night. All we have to do when we're awakened in a different position is get back into the correct position before drifting back off to sleep. Now let's talk about sleeping on your side. Sleeping on the side is likely the second best way to sleep at night. It's an excellent position for maintaining a nice straight low back and decreasing common muscle pain. People who sleep on their sides really ought to look at getting a medium firm mattress because at the wider parts of our bodies, like our shoulders and our hips, they're kind of pointy, right? If you've got a very hard mattress, you can get those joints' attentions fairly quickly. So make sure it's a medium firmness. Now, sleeping on your side also helps to decrease the amount of snoring. But I would say one drawback of sleeping on the side is still the squish face and the face wrinkles that commonly occur from the position. The best way to sleep on your side is in the fetal position with your knees together, but with your knees positioned together, but with a pillow between the knees. The pillow between the knees helps to straighten and reduce the stress or strain on the hips and or the pelvis while sleeping. Now there's another position that isn't always talked about, but everybody knows it once I explain it, and I call it the hybrid position. And so with the hybrid, you're kind of sleeping on the stomach and sleeping on the side as well. It's sleeping with one leg kind of hiked up, partly on the stomach, partly on the side. I'm sure you know exactly what I'm talking about. And this pure hybrid position is not recommended due to the twisting and stress it places on the low back and pelvis. However, a suitable technique to maintain this position could be achieved by placing a body pillow or a fat pillow under the hiked up knee to remove the twisting in the low back and the pelvis and to lay in a more straight, neutral position for your low back spine. Now this is a very common way to sleep for so many people, including this guy. And it can be done, but a pillow under the knee and hiked up leg is vital to long-term restful sleep and waking up with a pain-free back. So there you have it. Sleep, as we all know, is incredibly important, not only for our frame of mind and our relationships with others and our intake with coffee, but sleep is also very impactful on the intensity of the chronic pain that so many of us suffer from and controlling that chronic, long-lasting pain. Speaking of chronic pain, we can help. I specialize in chronic pain, and I specialize in coming up with a plan to get you out of it. So call us at 806-355-3000. Let's get you started on the path to feeling better and getting more done. If you're watching us on YouTube, subscribe, comment, and share. If you're watching on Facebook, like, comment, and share. Until next week, again, I'm Dr. Jeff Williams with Creekstone Integrated Medical. Take care, and we'll see you then.